Welcome, welcome, welcome to Monica May's One Take Live. We're so happy to have you with us. And please help us spread the word. Tap like and click the share button to invite your family, your friends, and followers to be a part of the conversation. You can always reach out to me at the end of the show or during the show if you have some questions, or you can always reach out to our guests later on. We're going to put their information up as well. One Take Live streams, as you know, live to Facebook. We're on YouTube, and now we're also on Spotify. Our guest is about to embark on something that was near and dear to me when I produced the Tom Joyner Morning Show for all those years, and that was Take a Loved One to the Doctor Day. We brought it out to Osceola County. We brought it into so many community centers throughout the tri-area, and it was wonderful. Dr. Belinda Johnson with Osceola Community Health Services is embarking on that time again, and her endeavor will be April 20th, and she's here to tell us all the wonderful things that will happen that day at Health Festival 2024. Dr. Belinda Johnson, how are you?
I'm doing well, thank you, Monica. How are you this morning?
I'm fine. I am so fine. Share the mission, first of all, of the Osceola Community Health Service.
So our mission is to provide quality health care for our entire community, those who are insured and uninsured or underinsured, to ensure that we have a healthy community. And we provide services for those who don't have insurance based on their ability to pay.
Okay. And we find that now with our economic, just the way things are right now in the state of Florida, that this is very, very necessary. One of the things that you and I talked about before we were ready to start our broadcast was that I noticed that we did that with Tom for about 13 years while I was his producer. But in the last couple of years, I saw the attendance dwindle. And I liken that to Obamacare. I'm like, people can now get insurance. They can go and see their doctors. They don't necessarily have to come out. Because the one thing that I realized, Dr. Belinda, is that we were saving lives on that one day. We were connecting them with healthcare providers, and that was good. And I will tell you, I always had an ambulance on standby, and this is a true story, because invariably we were going to have to take someone away after we got those really, really high blood pressures or really, really, really high blood sugar counts. And so are you thinking about things like that for your day?
We think about that for our day, and then for every day that we are open and provide health care. So a little bit about community health centers is they started back in 1965, and it was part of the war on poverty. And some grassroots community leaders in Boston, Massachusetts, actually Columbia Point Projects, saw that there was such a great need for healthcare, similar to what you're talking about, and how we can improve the lives of people. So they connected with Dr. Geiger Gibson, who was a physician in the area at that time. And through his efforts, the community health center, I guess
Was born.
It was born. So then, they spread throughout the country. They're like 1,700 now. Last year, we served like 31 million people through health services. And there are about, over 100,000 sites throughout the United States. And so the effort was to provide, like you said, those who did not have insurance, and there's still a good number who don't, and who need those type of services. So we want to make sure that on this day at the Health Festival, we provide those services, but not only those services, because we talk about the healthcare services, those that you get in the hospitals or your doctor's office. But those are those social determinants of health, those things like food and housing that really impact the outcomes of people's health. So at this festival, we have a coordinated effort of community partners who will be there to talk about housing, talk about food insecurity, like Second Harvest Food Bank, to talk about mental health services, which really impact our communities and the community outcomes. So it's really a collaboration of those things that people need on a day-to-day basis that we have pulled together to make sure that we can address the issues of our community.
In addition to all that Dr. Belinda Johnson Cornett just mentioned, for women, there is a mammography unit that will be on site, but we are going to ask that you register in advance. And we're going to share that information because all it is coming to the website to secure your spot. And that I say thank you, thank you, thank you. Because the sooner we can get a woman in to have a mammogram, the sooner we can really get the real deal on providing her health care should she need further services. What will happen if a woman is detected with just even a pinpoint of concern?
So we partner with Department of Health. They have a breast and cervical program. So we provide the primary care for those women and connect them to services. So we have a nurse case manager. So when there is unfortunately a positive result, we connect them with other community partners, hospitals, and cancer programs to make sure that they get the help that they need to make sure that they have successful and healthy outcomes.
hmm That is the biggest point, providing that aftercare. The
Yeah.
through care is what I used to call it. And, I'll make up a word in a moment. Sometimes they stick and sometimes they don't. But I would say the through care. And so for me, that also means the mental health piece.
Yeah.
Once I've received a diagnosis, what next? How do I let that sit with me?
Hmm.
How do I move forward in getting care? Am I going to sit in a corner and wither away just with the results? That's just the
Hmm.
result. That's the first piece. There's a
Yeah.
lot of mental health strategy that goes into a diagnosis.
Hmm.
So I'm sure that you all will have the mental health people there on site on April 20th to do all of that for everything, for all of
Yeah.
the services.
We do. We do. We partner with community services, other agencies in the community that provide mental health services. We also provide mental health services. We have psychologists and psychiatrists, and actually, one of our psychologists will be on site that day, Dr. Santiago. So we're happy about that, and not to just talk to those women who are receiving the screenings, but for anyone in our community who has issues or concerns about mental health services or their mental health. It is so prevalent, and it's often silent because people don't talk about their mental health. And we often identify issues when we're doing screenings. We do a screening for every patient that comes in for every visit. Things change so much. There's so many challenges. There's so many things that people go through on a daily basis, but many don't talk about their mental health. So we think that that's important and we incorporate that in our overall health.
That is so good, Dr. Belinda. I'm grateful for this because I had lunch with somebody actually yesterday, and she has a community-based service providing healthcare and information here in the Pine Hills area. And she said that she was noticing also the dwindling of numbers. And that's why I'm so excited for this event to happen because it takes courage to produce this, but the folks in attendance have to want it
Yes,
as much as we want to bring it to
yes.
them. And that's why I love the way that you and Timothy, your
Mhm,
wonderful media person, have
mhm,
incorporated music with this, spoken word with it to attract all genres, all
mhm.
ages of people. And we're hoping that you'll come out. We'll show you the flyer in just a moment. But again, this is going to be on Saturday, April 20th at the Johnson University there. And I had to ask a question and I said, this may sound different, but does Dr. Belinda Johnson own her own university? I mean, I really wanted to know that. And he said, no. What did you tell me? No, it's just coincidence, huh?
Yeah, well,
Just
we just think the festival, will bring the family out, and we know that families impact each other when they're talking about healthcare, and everyone needs to be involved in that. And we also wanted to make it fun so that we could attract people to come out and talk about some of the serious things about healthcare and how that impacts our lives on a daily basis. So it is, we look at not just individual health at Osceola Community Health Services, but we look at population health. So, our tagline is building a healthier future, one patient at a time. And sometimes it is one patient at a time, but that one patient can impact many others if they could be educated and learn about how they could do better with self-health care.
Hmm. One of the things that we always hear is how, as minorities, when something affects us, it really affects us. And
Yeah.
I applaud services like your own with Osceola Community Health Services because of the fact that you care holistically. In other words, you're not just looking at that person
Mhm.
as just a patient with a number. You're looking at them from head to toe. You're looking at the humanistic side of that person, and that's so good. So let's talk about that for just a moment.
Yeah, so we in healthcare realize the disparities that are out there, and that people of color, they don't receive the care that they do, and many times because of access to care, or sometimes people are intimidated to even go to seek care. And so we saw, particularly in COVID, that how disparities can really impact the outcome of someone's lives when something like a pandemic comes about, because
Mhm.
many people were already unhealthy. They had unmet health needs. And so, our goal is to make sure that we make people as healthy as possible, not just for quality of life, but to be able to endure when something as tragic as COVID comes, and that we can help them to be, healthy to begin with. Even with, COVID's one example, but even with pregnancy, we have really, high infant mortality rates and low birth rates within the Black community and other communities of color. And a lot of times it's because the mother's not healthy before she becomes pregnant. So we really like to focus on preventive care, getting people in, making sure that they're healthy for whatever may come in their lives.
Mhm. I noticed that PrEP will be discussed, and they're a part of one of the vendors and
Mhm.
sponsors for the upcoming health fair. And if we could just talk about PrEP for a moment, I work very directly with Dr. Andrea Dunn, and she's a pharmacist here with Advent Health, and
Mhm.
she really um, talks a lot about the what PrEP can provide.
Mhm.
And so, if I may just say something and that can piggyback off of this, she's going to come and speak at an event that I'm
Mhm.
doing for high school senior girls on their way to college, April
Mhm.
25th at my bistro. And the interesting thing about that is that before we sent our girls off to college, sometimes we gave them a sex talk, many times we didn't. The
Mhm.
importance of having that talk is going to save their lives.
Mhm.
And with PrEP, if you are not HIV positive, this is something that can prevent HIV, period. And I did an interview at the radio station with a strategist out of California, and he's gotten the PrEP talk all the way to the White House. And he
Mhm.
said to me, he said, they're aware of it. We are aware. They are aware of it, meaning the White House.
Mhm.
And that if we could get a community, people everywhere that are not HIV positive on this drug, we could curve this
Mhm.
dilemma by the
Mhm.
year 2030. I said,
Mhm.
that's just 6 years away.
Yeah.
But the conversation, the communication has to begin now. So I again applaud you for being purposeful by having PrEP speakers there, PrEP workers there. I did a billboard on Colonial Drive, and I'm not HIV positive, but I wanted to see the variances in ages. So I agreed to be on this billboard for free
Mhm.
to
Mhm.
show that it's okay.
Yeah.
It's okay to talk about this.
Yeah.
And so again, you are spot on, Dr. Belinda. Spot on. Some of the other services that you'll have on the 20th include what? Let's talk a little bit more about that.
So we will have some screenings looking at cholesterol, blood pressure screening, glucose screening. Diabetes is very prevalent in our communities, and again, is the foundation of many of the disparities and health issues that we have. And so, looking at, just recently, we had some legislature pass on insulin, but insulin is like life saving, and in many cases, people just could not afford it. And we have in our organization, we have pharmacy on site, and we have what we call a 340B program, or it's a federal program,
Mhm.
and it helps to defray the cost of medication. So a lot of the patients who were paying $600 a month for something like insulin could get it from us for like $60 a month or $30 a month based on their income. And so we want to do those screenings to identify those silent killers in our community. We have people who are walking around as diabetics or pre-diabetics, and we want to do some interventions to prevent those diseases from progressing. And so we're going to be doing some of those screenings on site as well. And we mentioned the mental health services. We will have some of our physicians there to help educate patients about health care and prevention and doctor's visits and why those things are important. And then we will have some other services there that will help them with those social determinants of health, like county housing, as I mentioned, food distribution, and just, an array of services. How, we talked about housing, we talked about, just people knowing what resources are available in the community that they may not be aware of, but they're in need of. And we're hoping to pull all of those services together so that they can be educated on that day.
Hmm. Again, this is a free event for everyone. You don't, do they only have to be from Osceola? Can they
Nope,
come? Can they
they,
drive over?
they can drive over.
This
Absolutely.
is good. It's on Beck Road in Kissimmee, and again, April 20th. And I suggest that everybody go over there, especially for those who are undoctored.
Yes,
Again, making up a word. But if you
yes.
don't have a doctor, the best way to begin to get good health care. And again, these doctors are going to be sympathetic, and they will allow you to realize that your own advocacy is the best. You have to be able to ask questions about your health. There's no question that these doctors, this is a different breed of doctor who
Yes.
wants to come out. And
Mhm.
that's the thing about healthcare events. These doctors are there because they want to be
Yes.
there. They're not trying to, you don't have to come to their office, that,
Mhm.
they're coming to
Mhm.
you.
Mhm.
If you choose to use them, down the road, that's fine. That's something you have to do. But how do we continue to encourage Black and Brown people to begin to take healthcare serious and to begin to learn how to advocate for themselves?
That is really a good question, and advocating for themselves is really important. And I know we are often intimidated when we go to the doctor's office. It's sometimes rushed, and sometimes, I talk about even with like maternal child health or pregnant women. I've had some focus groups with some of our patients, and sometimes it's that what they're facing or what they feel they're facing, and a lot of times true, is that unconscious bias, and they feel that they're sometimes treated differently or they're feeling different. They feel some kind of way that's not comfortable to them. And so, if we could try to minimize that, eliminating things like that is often impossible, but minimize and train our staff as we do about cultural sensitivity and those unconscious biases and not letting them rise to the level where it impacts patient care, we can have more people come in and just come in for that preventive care. We get
Mhm.
people come in with episodic care, or when it's, when when their blood sugar levels are very high, or that pregnant woman who didn't come in the first trimester, now she's a high risk mom. So we take the opportunity to educate our communities about the seriousness of not having that preventive care. And we
Mhm.
often do have focus groups where we talk to them and just find out what kind of things could we do better in our settings to make them feel more comfortable. So that's
Mhm.
a challenging piece, and we continue to work on it, but clearly extremely important to make people understand or help them to understand the importance of ongoing health care.
I have to tell you something, and this is another light bulb moment.
Mhm.
It is sharing it is me being transparent.
Mhm.
I am college degreed. So
Mhm.
what? First child at 31.
Mhm.
Very bad relationship. So I'm actually in an abusive one. Did
Mhm.
not get the proper health care during the pregnancy. The first trimester was done at Grady Hospital. They tried.
Mhm.
I tried to
Mhm.
keep the appointments. Um, I moved in the second semester, trimester, and was not getting health care at all.
Mhm.
By the time I was set to deliver, the doctor to see me for the first time.
Mhm.
That is not a good thing. That
Mhm.
is not a good thing. And so, believe it or not, come time for me to deliver, Dr. Johnson, I almost died
Mhm.
right after the child was
Mhm.
born.
Mhm.
And it is because there were so many things that I could have done for myself, not knowing I'm college degreed,
Mhm.
but you don't know
Mhm.
everything.
Mhm.
So I'm saying that and being transparent because it can happen. It
Yes.
happened to me.
Yes.
And I got to tell you, I struggled. I nearly died in that
Mhm.
delivery
Mhm.
and was sent home with the placenta still in me.
Mm. Oh.
Okay. That caused another set of
Yes.
issues. So
Yes.
I say those things because this is real talk, you guys.
Yes.
I always talk from my own experience. That's how
Mhm.
I'm teaching. That's how
Mhm.
I'm so into what I'm sharing.
Mhm.
And so there's never a question or a moment in time that someone won't listen if you just open your mouth.
Yes.
And I was struggling and I chose not to open my
Yes.
mouth. How's that going to look? Here's Monica
Mhm.
May. You
Mhm.
know,
Mhm. Yes.
forget about all of that. It's just got to be you and this baby, you and whatever your health situation is. There is a way out. And there are
Mhm.
people like Dr. Belinda that can help you, lead you to the right person. So,
Yes.
April 20th at the Johnson University in Osceola County, I would say that should be your first stop and
Mhm.
then find the care that you need. And then let's talk about your why. Why do you
Mhm.
do this, Dr. Belinda? Why?
So, so personally, I have been in healthcare for many years, and I worked in the hospital setting. And when you're in the hospital setting, you get people ready, you discharge them from the hospital, and they go. I had the opportunity to do some home visiting at one point in time. And I saw when we discharge patients from the hospital where they go. They go without any resources, without services. You tell them to follow up, and lives are challenging. And that's the last thing on their list, but one of the most important things on their list. So then people go without, and the next time we see them is in the emergency room. So that really brought focus to me about how I and others could be important in the community in helping people where they live, work, and play, because that's where they're going. If they can get connected to that type of environment, you will be able to make a lot more health improvements in their outcomes. And so I just feel that it's so important to provide whatever services we can provide. And if we don't have those services, to know the resources to connect the patients to, because it
Mhm.
is about that whole person, about that whole family, and making sure that they all have the resources they need for successful outcomes.
Mhm. One blood mobile will be there too.
Mhm.
And during the time of this disastrous
Mhm.
delivery, I had to
Mhm.
have 10, well, 9,
Wow.
9 blood transfusions. And
Wow.
there's not that much blood in your body. So that's like
Mhm.
almost a full body
Mhm.
transfusion. And at first, I was very hesitant because I'm saying, I could, suppose I come up with AIDS.
Mhm. Mhm.
Suppose if I had just been able to ask the right questions, I
Yeah.
knew them, but didn't have the confidence to ask them.
Mhm.
College degree now.
Mhm. Mhm.
What was wrong with me? So anyway, I wound up having the transfusions, and
Yeah.
then consequently, when I went back into the hospital for the emergency surgery to remove the placenta, had to have
Mhm.
several more. So I'm saying that I have become an avid blood donor and now platelets. And so there are so many ways that when things happen to you in crisis, you can turn that crisis into something where you can use it as a give back moment.
Yes.
And I'm hoping that people listening to our conversation will take these things into consideration.
Yes, absolutely. And that is it's so key. And it is intimidating. Healthcare is intimidating.
It very.
It really is. And we try to make it, people understand, there are no crazy questions, no stupid questions. They're all important questions. At the Health Festival, as we speak of maternal health and pregnancy, we will have the Healthy Start program, and they will be there to talk to women about the services that are available, the in-home services when they come home from the hospital, so that they then feel comfortable in their environment asking the questions they wouldn't if they went to the health center or while they're in the hospital. So that's another service that we will have there available. So hopefully people who are, dealing with any of those situations will stop by and talk with them and get the resources they need for successful and healthy outcomes.
I am going to make it my mission to just help spread the word so that people from Orlando who need services will travel over to Osceola County. It's not that far away now. Come
No,
on.
it's not.
A lot of times, if we're here in Orlando, oh no, I can't go
Yeah.
on the east side. It's too far. Oh no, I can't go to Ocoee. It's too far.
Hmm.
So I really want to encourage people to come out April 20th. It's a Saturday. What else are you doing? 11 a.m. to 5 p.m. at Johnson University, Bill Beck Boulevard, and it's free. Free
Mhm.
parking, everything, a host of entertainment, spoken word as well. And the importance, oh my gosh, there's some, and I'm sure there's a lot of free stuff that they'll be giving away
Mhm.
too. All
Mhm.
right. So I just wanted to just really introduce you to the woman behind all of this with Osceola Community Healthcare and Community Health Services. This is a woman on a mission. And we got to help her get to that mission. The mission is about saving people's lives
Yeah.
and being able to let you know that healthcare is affordable,
Mhm.
healthcare is necessary, and healthcare is your duty as a human being. It
Mhm.
is your duty to stay healthy. It is your duty so that you can work. It is your duty so you can raise your family. You can't do it if you're not feeling well. And what is that nagging feeling? It could be something that's mental health driven too.
Mhm. Mhm.
There'll be people there to talk about that. It could be that your pressure is just exceptionally high. You
Mhm.
may not have the cuff at home to take your blood pressure. Well, come in and somebody will take your pressure for you, and they can help you with things that can lower it. And we think about, I don't want to take this medicine. It's going to do so and so and so. If it's going to keep you alive, that's what
Mhm.
I need you to understand. Will you have anything for men, prostate care, anything for men?
Well, we have our medical unit. So we have adult primary care providers. So they will be talking to the men and women. We have a pediatrician there for children specifically. So the conversation and education for men and women will be available through our providers.
Will you have prostate
We,
testing?
we won't have any testing that day.
Okay, but you can lead them to
We can
prostate
lead
cancer.
them to testing with a visit with one of our providers
Mhm.
and or connecting them to community services that could provide that.
This is a year-round program that this woman provides. This is just one day of free services, but she provides health care. Where is the clinic located? What's the
We
address
have
for it?
we have 10 locations.
So
Through
where's the one that's closest to
the
you
one is
in
closest
Osceola County?
the one is closest to this is 1501 Bill Beck Boulevard. It's actually right
Okay.
across from Johnson University
Okay.
field where we will have the event. And there we have primary care, all ages. We have maternity care there as well. And
Mhm.
right down the road, we talk about dental health. We'll have our dental unit there, but right down
Yes.
the road, we have a dental facility as well. We'll provide dental care throughout our organization for all ages.
I love that. And that's for smiles. Okay.
Yeah.
And smiles are very important.
Yes.
Cheese. Dr. Belinda Johnson Cornett, thank you very much, the CEO of the Osceola Community Health Services. Their event, Saturday, April 20th. You can go online. We'll put the information up. There is a phone number for her as well, 407-414-9760. So thank you very much, Dr. Belinda, for
Thank you.
being on Monica May's One Take Live.
Thank you very much. Thank you for having me.
Yes, and we appreciate you all. Don't forget, tap that like and click the share button to invite your family and friends to join in on our conversation. And make sure that you check out our live stream on Facebook, on YouTube, and now on Spotify. Thank you.